you have to train yourself. You have to study a lot. You have to participate in communicating, networking, etc., etc. And then suddenly you see that step by step, you start helping other people. You start helping people that are coming after you. They need your help. They need your advice. A word sometimes. I think this power of collaboration is very, very important. For me, it's just natural that I don't feel that I'm better than I think any other person could be there in my place, doing the things that I'm doing. Every time that you do it with your heart, when you really want to be there, when you're really inside the environment, I think this is the point of life.
You have to be natural. You don't need to compete with anybody to be better than anybody. You need to collaborate with people, helping other people that will come after you. They'll need your art.
Welcome to Global Diabetes Insights, your go-to podcast for navigating the world of diabetes. I am Tino, a certified diabetes educator and a global advocate for non-communicable diseases.
And I'm Kona, a global advocate and a medical doctor. Together, we're your hosts, dedicated to raising awareness, fostering open discussions, and creating a safe space for everyone affected by diabetes.
Join us as we dive into empowering conversations with individuals living with diabetes, caregivers, healthcare professionals, and researchers. Our goal is to not only guide you through effective diabetes management, but also to inspire advocacy for proper healthcare access.
So get ready for a journey of insights, ideas, and diverse perspectives. Let's amplify our collective voice and create positive change. Get involved, get engaged, and join us in creating the change we need. So welcome everybody to Global Diabetes Insights.
Well, thank you. Hello and welcome to another insightful episode of the Global Diabetes Insights. So today we are honored to have a distinguished guest who brings a wealth of expertise to the world of pediatric endocrinology and diabetes care, Dr. Tiago, a pediatric endocrinologist with a passion for addressing health inequities and obesity, is joining us to share his valuable insights. We are thrilled to explore various aspects of his career, research, and advocacy work. So without further ado, let's dive into this enriching conversation with Dr. Tiago. So Dr. Tiago, I think would allow you to introduce yourself to the audience. Over to you.
Thank you, Chino. It's a pity that we have to do it this way, in a virtual way. And we know that we had planned to do this during the meeting in Rotterdam. I very well know Chino. We work together in the SPAT community. First of all, it's time to kick off, and I'd like to introduce myself. Well, I am Tiago, originally from Brazil. I had my medical school in Porto Alegre, in southern Brazil. Then I moved to São Paulo to finish my pediatric endocrinology training. I had the chance to come to Madrid 2016, and since then I start to be more and more involved with diabetes, especially type 1 diabetes, which was really my passion during my pediatric endocrinology training. My main focus was to study diabetes related technologies under an umbrella of equity. When I finished my doctoral studies, I moved to clinical again. When I moved to clinics, I start work a little bit more with SPAT society as well as another medical societies which I belong, like ESPE, which is the European Society, also the Latin American Pediatric Endocrinology Society, the Spanish Pediatric Endocrinology Society. I try to be very well engaged with some medical societies because I feel this is the only way that we have to do some difference for our patients, but in a different perspective, not only with clinics, but also supporting other peers, other colleagues all over the world. Basically, right now I do clinics, I do research, I also teach at the university for medical school, nursing school, and physiotherapy school here in Almería. Right now I'm based in Almería, and a part of that, I volunteer for ISPAD as an advisory board.
I cannot think enough. So here's the reason why I didn't want to interview you, because I know you too well, and so we have been working together for far too long now. A big shout out to Kona. She was supposed to be the one doing this, but now, considering her work as a doctor, she had to be in the clinic. So thank you so much, Tiago, for sharing that overview with us, like your focus areas, your research, where you're working in the hospital, and also teaching in the university. So I think we are going to delve deeper into all those things that you are doing, especially in Madrid. Madrid. You're Brazilian yourself, but then you had to work in Spain, in Madrid, which is just amazing, right? We just wanted to know how your diverse experiences contribute to your role. You're specializing in pediatric endocrinology. You're working in the hospital and you're also working at the university. If you can share with us, people who need motivation, especially listening from seniors like you.
I don't consider myself a senior person as well. When I moved to Spain, I knew that I was starting a new world in my professional career. Everything was starting to be very well settled down when I was in São Paulo. I was doing well. I didn't have an official position in a hospital, which was a big hospital that I belonged at that time in Brazil. I just wanted to see other things in the world because, Brazil is a country, is a upper middle income country, and you have a lot of difficulties that most of developing countries or low resource countries also face. So I had the chance to see how we diabetes care in a country that we have to face a lot of difficulties. Then I moved to another atmosphere, to another environment. In Europe, we may say that we have the most updating technologies, the most updating service, the most updating diabetes care. So I could see those big two worlds, not only about diabetes care, but also about medical care, I may say. I think this is one of the most things that impacted myself regarding my decision to study not only type 1 diabetes, but also health inequalities. We have a lot of health inequalities in the world. I know sometimes we may say that, we have discussed it a lot. We have a lot of forums of discussion. We have a lot of people working on it. But I think this is something that should really be announced, that we still have been struggling with inequalities around the world. More and more right now that we have a lot of newest diabetes devices, technologies in United States, for example, and some European countries. Sometimes you don't have even glucose monitors in other countries or even insulin analog in some countries. They're difficult to access to very basic diabetes care in some countries. So this is something that not only important to discuss, but also to give attention on it. We should really talk about it, and we should not only talk about it, but also try to move things politically, advocating. I think this is something that shaped a little bit my personality about doctor, because as I could live, as I could feel how is to be a doctor struggling with medical and diabetes care in a low resource country, and now living in a country where I have all the facilities to get the most advanced technology or the most advanced drug for my patients. I see that, okay, that's fine that I have this another phase of diabetes care, but it's also fine if I keep up studying. Why do we have this gap? How can we narrow this gap more and more to combat this gap? So this is why I focus my doctorate studies in inequality. I did want to study diabetes technologies, but with a focus on health inequalities. I didn't miss this hope, trying to offering good diabetes access for all over the world, and having a position as an advisor member in ISPAD and working together with other medical societies, not only global society, but also regional and national societies, and be in touch with some Brazilian colleagues as well. I think this is the point that makes me waking up every day and trying to do my best as not only a pediatric endocrinologist, but also diabetes advocating as well. Because as we listen about diabetes advocating, patient, no, I think if we really love to do what we do to work with diabetes, we as doctor and nurses and other allied healthcare professionals are also advocating for diabetes community, and it is so important to do this.
You speak with so much zeal, with understanding of the things that you're doing, the things that you wanted to focus on. That is just great. Thank you so much for all the work that you do behind the scenes. Like when we meet at conferences, we're now focusing on what is happening within the conferences, but also there's a lot of things that are happening behind the scenes. For you, working with so many societies and also trying to contribute within your own space, your own community, where you came from, which is great. Thank you so much for what that you do. Your focus mostly is on health inequalities, health inequities. So it's good to see like medical professionals also trying to advocate for other things so that we could close the gaps that are inexistent and so that people can get the proper quality of healthcare, access to care that they need, and so that they can achieve a higher quality life that they should. I think now we are moving on to another juncture, which is research and expertise. And I see how some of all these things can help inspire, empower, encourage, and educating the diabetes community, inspiring other healthcare professionals, empowering people with diabetes and their parents, and also encouraging even researchers with all that you do. So like I said, like your research line focuses on type 1 diabetes, diabetes-related technology, and health equity. Like, how do you see these aligning with these visions to say, trying to empower, inspire people, encourage, and even to educate people? I know that, like you also mentioned about advocacy. So this is something that we strongly believe in, that we need to continue advocating. We need to come up together so that we could help change the sad narrative that we have in this world.
Once you have an opportunity to do a doctoral study, I'm sure that you will love it. You will love it. This is a moment of your life. You really know yourself, it's very different of degree because you know that you have your mentor, you have some other colleagues are very well connected to yourself. You commit yourself to develop something that should be very useful for other people, other researchers, other clinicians, etc. One of the things that I love to study is about the social determinants of health. It's not only applied to diabetes as a condition, diabetes care. It can also be applied for any condition, any disease condition, etc. But regarding diabetes, the social determinants of health that I studied during my doctorate, the country where you live is also a social determinant of health. As we may know, there are different income levels depending on the country, your gender, your level of education, your income, your parental status, socioeconomic status, etc., etc. So social determinants of health mostly determine the way that you live with your condition. Most important things that I saw is studying that we have very, very few research low resource setting countries. How can we say that someone can have a good diabetes care, an optimal diabetes care, get some kind of treatments or some sort of treatment that are not offered in high-income countries? How can you just say, okay, diabetes care in, I don't know, just an example, in Brazil is not as good as it is in Spain? How someone can say something about that if in Brazil children and adolescents or young people or even adults, elderly with diabetes cannot receive the most advanced in the world? How can we compare those countries if we don't offer to those people the best current treatment in the world? So this one was one of my conclusions, that we cannot compare countries' diabetes care because we cannot say that it is a perfect offer for the best ever treatment for those patients. This is why I think social determinants of health is something that really have to pay attention on.
Thank you for pointing it out, raising an awareness to say we cannot really compare the standards of care of America to a country like, say, Mexico. Like in Africa, most countries, there is no access to diabetes technology like CGMs, no pumps. We cannot compare the diabetes care standards with what is being offered in Spain and other European countries because we don't have the same things. We need an understanding if these people are to come to attend conferences. So for them to feel welcome, they need you to be talking about the things that are affecting them, right? Social determinants of health. And I've seen people are now discussing about it. And now I think we can even call you a global pediatric endocrinologist because you know these things that are affecting people in the less remote income countries and also in the high income countries. There was a time that you went to America. It was a fellowship, right, that you did in Cleveland. What can you share with us about that? Like, I know there was a study that you did there.
Cleveland is also in my heart. While I was studying my doctorate studies, I had this opportunity to go to Cleveland. I visited Dr. James Wood, ISPAD Secretary General, and I stayed for 6 weeks in the unit, the diabetes unit. This was amazing because something that happens in the US is that you have all of the most advanced things in the world about diabetes device, almost have here in Spain And in Europe, they are much more advanced because everything starts very earlier in the US. So second step in the world come to Europe. We have those most advanced, but they are the first one in launching everything. So I wanted to see that. But at the same time that they have all of those advanced newest devices, they also have a lot of people struggling to access to that because there is a huge problem of inequality, of disparity in the US. I could see that, and that really touched me. Dr. Jamie Wood mentored me. We published a study, which was a survey-based study with pediatric endocrinologists around the world. We created some clinical cases that we asked for some providers around the world. What should you do in your clinic with this situation? So there are a lot of different case scenarios, different situations. For example, a young girl with type 1 diabetes, with suboptimal diabetes control, that has a lot of diabetes ketoacidosis episodes, living in a family with some socioeconomic problems, father or mother unemployed, etc. So what should you offer to this girl? Full diabetes technologies, only glucose monitors, none of them? Providers should answer about these case scenarios depending on their background, depending on their country, on their expertise. So depending on many variables, many factors, we analyze those results. We conclude that, look, I'm talking about not only the US, I'm talking about the global world. You conclude for most of medical doctors that work with type 1 diabetes want to offer the most advanced diabetes devices for their patients, but they are prevented to apply those technologies because of government reimbursement, healthcare coverage, and healthcare insurance. So, again, here, the main obstacle is money and reimbursement. But it was a very nice study. So this was my experience. And of course, to have the chance to spend a whole 6 weeks with Dr. Jamie Wood, who is amazing as a doctor, as a mentor, as a person. This was a little bit about my experience in Cleveland.
Bravo. Thank you so much. And a big shout out to Dr. Jamie Hood if she's listening to this. I think it's also a good thing to also get a few of, especially the higher income countries where they have the most fascinating diabetes devices, diabetes technology in the world, seeing people that also have some challenges trying to access them. I mean, we all need to advocate. Thanks for those fellowships that allowed you to go there to do that. I think now we're jumping over to another junction on the global involvement and collaboration, which we are talking about already, about the fellowship. And I know you're part of so many fellowships, and it would be bad if I mention some and leave out others. So I'll try my best to mention all those that I know. And if I leave out others, please do list them so that the junior doctors or anybody who's listening could also try and sign up to those. For example, not just a member, you're an active member of ESPE, you're an active member of ISPAD, where we work together. There's also CED, there's SLAB. So how do these international affiliations contribute to a global perspective on pediatric endocrinology? And how can this perspective be harnessed to create positive changes in diabetes care globally?
This is important to have. Of course, most of them are international affiliations, but it's important for you to have also connection with some national and regional affiliations and societies as well. If we're talking about diabetes, type 1 diabetes, of course, it's somehow embraced with pediatric endocrinologists, just like an arm of pediatric endocrinology, a specialty. I think being involved with all of those societies allowed me to contribute and benefit from a global exchange of knowledge in pediatric endocrinology and also diabetes care. I think this international perspective is key and has been the key for me in understanding diverse healthcare challenges and innovations. It's something that I feel myself that it drives positive changes in diabetes care worldwide if we are very well connected with those associations. For example, I can mention my role in two of them, the ISPAD and ESPE. For example, regarding ISPAD, I have this conflict of interest about ISPAD because my experience with ISPAD started in 2014. I was still a pediatric resident in São Paulo, and I had the opportunity to participate in a science school in Boston at Joslin Diabetes Clinic in Harvard. So that was amazing for me at that time. That was my first time in the US. ISPAT, as a big and robust society, gives support for medical, nurse, nutrition, psychologist, and any allied healthcare professional. Also advocate patients, support them to thrive in not only diabetes care, but also diabetes research and interconnect to each other and networking as well. So we started in 2014. We started to discuss to create something in ISPAT because at that time, ISPAT didn't offer anything similar. 2 years after, in 2016, we had our first meeting in Valencia, here in Spain. Since then, Genius started to be engaged with different projects. We started to publish our first researches and engage more and more people. And now the Genius member is a very important part of ISPAT. I may say that we be between 20 to 25% of all the amount of ISPAT members are Genius members. So it's a lot of people. Right now, I should say that something that really was a positive thing that was supported in the beginning. We are now thriving with our own legs. This is good. And this is something that I feel that medical societies can do, because one can think, okay, but it's just a group of networking. Yeah, but networking is all in your life. Imagine you have an issue with a patient. I don't know how to apply this fellowship. I don't know what I can do in my life. What is my next step? How can I contact to do something different or similar? So imagine we have a group of people where you can talk to each other, where you can vent. It's good to know that you belong to a group where you can count on. We had a turnover of leaders. I had the chance to be a leader from 2020 to 2022. That was a great experience for me. When I was finishing my term, I was elected to be an advisory board member in ISPAT. Things that we do in ISPAT, we know that it impacts a lot life of people living with diabetes. I feel the best that I can do is volunteering as advisory board member in ISPAT.
It's great because you're sharing from your own personal experiences, what you've experienced, being part of these international affiliations. And I hope that it will inspire somebody to join such organizations like ISPAT, for example. When I became an ISPAT member, they thought I was a medical doctor. They thought I was a student. I was a patient advocate. And now there was a change. Now they know that they are patient advocates, and now patient advocates are welcome. It is people like us can come in, because it's always great. Whenever there are guidelines being reviewed, there's need for a voice from people living with diabetes. It's so great, so balanced. Thank you so much, Dr. Tiago, for all this you've done, from being a volunteer, working closely with the Genius group. And networking is just a huge opportunity, because you can network with the big people working in diabetes, people from all over the world. You can do so many. Networking is priceless. When I research the things, your contribution in the international diabetes community, I saw a lot of writing, contributions on healthcare during the COVID-19. You did a lot of work. Thank you so much for people like you. As it were, when COVID-19 presented itself, people thought that people with diabetes would suffer the most. So thank you so much for taking your time to research more about it. One of the publications on telemedicine and COVID-19 pandemic, it indicates a keen awareness of the evolving healthcare landscape. So how do you see the role of technology and telemedicine in shaping the future of diabetes care? And how can these innovations be effectively communicated to the diabetes community through platforms like this podcast that we have today?
Thank you, Chino. During COVID pandemic, I have just moved here to Almeria. Most of our patients had some clinical condition, which is type 1 diabetes. We, at that time, very scared about what could happen to them. If a new virus, a new diseases, how could it impact them and their treatment and their care and also their supplier? Didn't know what was happening in the world. So a group of people, ISPAT as well, we decided to develop research project, a survey based to check how was COVID-19 impacting diabetes care all over the world. I think we were very timely to do this study because it helped a lot of consequent publications and research based on our data. But the good thing is that I think that human being, we are very well adaptive. We adapt completely and we accelerated the way that we were starting doing diabetes care or giving more importance to telemedicine. And telemedicine is not only call or video call. Telemedicine is also the chance that your patient, the patient that you are wearing a pump or a continuous glucose monitor, having this data from your clinic or from your home, you can check it and try to give them some suggestions what to do. I may say the good things about COVID that just accelerated the way that we use telemedicine in diabetes care. All over the world, that every clinic adapted their clinics in virtual care as well.
Thank you for involvement in helping change the narrative from the standard care to the virtual care. And it's a good thing that you were able to adapt quicker and also try to help people shed more light on diabetes and COVID-19, how it could be related and how doctors would still offer amazing and greater care to their patients or to the people that they see. Now the world is a different place because of people like you. We need people like you who are always adaptive. If we have a new virus, a new epidemic, things that we still don't have an understanding, you still need those proactive approaches to say, how best can we approach this? The world has already changed. People can now get their doctor's consultation virtually, seeing them like this, and then they will speaking with you, you send your results, thanks to CGM. Your doctor can also have access to the results, or you can just send to them. Thanks to Telemedicine. Right. Now let's focus on the educational initiatives that you're doing. Were you working with these big organizations? Your participation also as a speaker in international conferences, your role as a tutor, for example, at ISPAD Science Schools, which you're a product of ETESO, but now you're a tutor at the ISPAD Science School. So how do you approach the task of educating and encouraging both professionals and people living with diabetes within the diabetes community?
At first, you have to train yourself. You have to study a lot. You have to participate in communicating, networking, etc., etc. And then suddenly you see that step by step, you start helping other people. You start helping people that are coming after you. They need your help. They need your advice. A word sometimes. I think this power of collaboration is very, very important. For me, it's just natural that I don't feel that I'm better than I think any other person could be there in my place, doing the things that I'm doing. Every time that you do it with your heart, when you really want to be there, when you're really inside the environment, I think this is the point of life.
You have to be natural. You don't need to compete with anybody to be better than anybody. You need to collaborate with people, helping other people that will come after you. They'll need your advice. During the ISPAD 2023, you chaired the ISPAD Top JDRF Joint Symposium on Global Pediatric Diabetes in Development. What can ISPAD members do? So if you may kindly share the key highlights from that very session that you shared. And I know probably you spoke on other sessions, but I'm particularly interested in one that you shared yourself. What were your key learnings?
Thank you, Chino, for your question. Actually, it was the opening symposium in the last conference. I was very, very glad to be there with Dr. David Maas, current ISPAD president. We had a very nice plenary. It's centered on global pediatric diabetes development. The key highlights, I should say that it included discussions on latest research, innovative treatment strategies, the importance of global collaboration in advancing diabetes care for children. Regarding your question, if I could have a key highlight, I should mention again that we should focus on health inequalities. We talk a lot, but maybe not that much that we should talk, that should have been talking. It's important that we not just talk about it, but we should start acting, increasing these health inequalities.
Thank you, Dr. Tiago, for sharing your key highlights and also sharing your own opinion about this. I know with the health inequity, it's just something that is closest to your heart, also something that we would want to help push, even with our podcast. So now we want to advance on equity in diabetes care. The focus on health equity is super critical. How can the efforts to address disparities in diabetes care be integrated into broader mission of our podcast to create a more and inclusive, accessible platform for diabetes education and support to people that would want to listen to?
Unfortunately, we have to count on healthcare policies, and healthcare policies are decided by politicians most of the time. When someone doesn't want to talk about politics, I think this person should rethink about it. I think politics should be talked about, because politics in the world that we live is something that leads us to live, work, to study, and also to be cared. If I have a message for the listeners, unfortunately, again, we have to be the ones that lead the way that we live are the politicians. So we have to rely upon them. We have to rely on their decisions. Because of that, my main message should be that we pay attention at politic decisions. Politic decisions is something that really impact our life. Medical doctors, nurse, healthcare professional, patient advocate, and also medical societies support and help a lot to change health policies. I think this is something that we should pay attention at the politicians that we elect, the politicians that we want to represent us, our decisions, our vote, our message, the message that we spread around different communities, our own community and international community is so important.
Political things, they're always critical. They affect us even if we don't want to be part of it. Some people, they're ignorant to the extent that they don't want to even participate on voting for the people that are going to have to do everything for them. It's what I've been seeing in the idea of publications that they publish from 2025. I think the budget for diabetes alone could reach $1 trillion. Most of these costs, we incur them when people are hospitalized. So if you can avoid hospitalizations, providing care that people need, just insulin, but because when somebody is sent into the hospital, they will need a lot more hospital beds. There's so many other things, and you might even need to fly people like you, Dr. Tiago, to come to Zimbabwe so that you can offer care to people that we have, because we are not paying attention to the things that matter to us. So we need to suggest, because they should be representing us. We elect them, right? So thank you for that. So I think this can help address the issue of health equity, because it is just a critical subject as it is. With our podcast, it's been there since 2020. And when this started, we emphasized really on collaborative change as a podcast for Global Diabetes Insights. So like, how do you envision fostering engagement and collaboration within the diabetes community to collectively address challenges? We have so many of them, share insights, and contribute to the positive transformation in diabetes prevention and management.
I just want to thank you about this talk. A final message, a closing thought about that. The power of collaboration, innovation, education in transforming the landscape of diabetes care. We are healthcare professionals, researchers, people living with diabetes, caregiving, taking care of people with diabetes, or advocates. Anyway, each of us unique and critical role to play in diabetes care. Staying curious is so important because it transforms the world. Embracing new technologies and ideas and trying to give more access to all of those newest technologies and ideas, we can make significant difference in diabetes care. I think Global Diabetes Insight foster dialogue in the field of diabetes care. I think this is something that really touched your audience. Just to congratulate you and Constantine for the important role that you are doing for this community. Again, thank you a lot for this opportunity, Chino.
Thanks to you. I would say obrigado. I don't know if it's obrigado, if it's obrigado, but thank you so much.
You should say obrigado.
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 Right. Maybe your last words that you can maybe say in maybe Spanish or Portuguese.
Para los que me escuchan en español, bueno, espero que haya los subtítulos y que puedan, aquellos que no entienden completamente el español, porque pueden ver por lo menos por los subtítulos y si tienen alguna duda, pues me pueden preguntar. E para aqueles que vão me ouvir em português, estou quase seguro que muitos colegas do Brasil, muitos familiares, muitos amigos do Brasil também que queiram me ouvir. Também estou aberto para conversar com vocês com o que seja. E um abraço para toda a comunidade de diabetes do Brasil, que eu sei que também faz um papel excelente nesse país maravilhoso que é o Brasil.
This was for our audience. Dedication to our audience. They would feel this. This is so great. So like, as we wrap up with this engaging episode with Dr. Tiago, we want to express our sincere gratitude for his time and invaluable contributions. And I know you're a busy person, but I know it just flipped. For your dedication to improving diabetes care and addressing health disparities is truly commendable. This is what we feel. This is our words to you. So we hope this episode has been as enlightening for you as it has been for us. Like for me, for example, was interviewing you. So basically this was not an interview, it was sort of like a discussion. Thank you so much for that. So remember to subscribe to the Global Diabetes Insights for more enriching discussions with experts in the field. Thank you for joining us on this journey of learning and sharing. Until next time, stay informed, stay empowered. This is the Global Diabetes Insights.